Welcome to our conversation on brave feminine leadership. I'm absolutely thrilled to introduce to you today Professor Gemma Figtree. Hello, Gemma, and welcome.
Thank you very much. It's great to be here.
So I'm just going to kick into a little bit of your bio for people of who you are. And so Professor Gemma Figtree is a mum, is an interventional cardiologist at the Royal North Shore Hospital and a professor at the University of Sydney. 5 years ago, Gemma took on the role of President of the Australian Cardiovascular Alliance and set about transforming that organisation. And in 2019, they secured federal funding of $220 million towards cardiovascular health, an amazing achievement. And in all of that mix, Gemma, you also manage chickens and whippets.
I try to.
It's fantastic to have you here. Before we kick into our conversation today, I want to thank you for taking time out to join the conversation. And I guess just lead off by saying that, cardiovascular events are the leading cause of death amongst women. And, I have to say that, in my peer group, we would probably list something as breast cancer ahead of that, and certainly in terms of our awareness of that. But can you talk me through a little bit of that, something that I think a lot of my peer group would still perceive as a male disease?
Yeah, absolutely. I mean, as women, we're actually, we do present with cardiovascular disease slightly later than our male colleagues, but even young women, cardiovascular disease is one of the biggest killers there as well. So, I mean, between 35 to 50 or 49% of women across the world die of cardiovascular disease. So it's absolutely the leading cause. And much of this is absolutely modifiable with the things we know. But there is also a lot that we don't know still about what drives individual susceptibility to getting coronary artery disease, heart attacks, heart failure, and sudden death. And so this is something that we need to continually to work on. There's huge inequities as well in terms of who's actually suffering the greatest mortality and morbidity in this space. But as you say, awareness is actually a really important aspect of this. And I think there is, some degree of kind of community sentiment that heart disease is all solved. It's just what people do to themselves. And, it's just that people aren't looking after themselves, which is something I'm very passionately advocating against. Whilst we do know at a community level that these major risk factors, including obviously smoking, diabetes and diet, etc., drives disease, there is so much more that drives the individual susceptibility that is not their fault. And we need to change the way we look at this. Whilst maximising health, we need to also make sure that we tackle all of the unknown about cardiovascular disease.
Before we go any further, can I just ask, what does an interventional cardiologist do?
We're the plumbers. So we're trained as physicians, not surgeons, but we do have a little bit of a surgical kind of approach and mentality to things. So particularly here at North Shore, where we see a lot of acute heart attacks, we get patients triaged directly from the field. So sometimes in the middle of summer, that's people straight from the beach in their swimmers, and they get sent straight through to the cath lab with really good communication from the ambulance to us, and we get activated the minute the ambulance picks these people up. And we basically spend our time trying to, as quickly as possible, open up the blocked artery that's causing the heart attack.
Okay. So you're the ones we want to see in that.
Yeah, so we use a little artery in the wrist and actually use that as an entry hole to get back up to the heart. We have one of the most amazing things is the team of people that actually work together to tackle, to really try and sustain life whilst actually opening up the artery.
Thank you for doing such amazing work. How did you get here, Gemma? How did you? Let's go right back to you as a child, and what led you down this path?
Yeah, I had a very privileged upbringing. I grew up here in Sydney and was really completely lucky to have a scientist as a mum and a radiologist or a doctor that does a lot of imaging as a father. And I think we're lucky to be exposed to the amazing aspects of both, the human body, but actually just obviously, animals, the world, how it works, that kind of thing was something that was embedded in our upbringing. And I think I've always had that awe about, you know, how lucky we are with our health and what our bodies actually can do. So that was part of my early kind of, I guess, passion for medicine and optimizing health and understanding of how we work. So that was one part of it. I also was lucky to go to a school where STEM was really, you know, I guess, very well taught and a big priority. From fifth grade, it was a private girls' school that had a very dedicated, you know, history of promoting, you know, effectively girls can do anything, and you know, accept the challenge on that front. So I've had particularly inspired by a science teacher that taught me particularly for the last years of high school, and you know, at the time I actually was tossing up between teaching engineering and science kind of things and medicine. I think ultimately I always wanted to do medicine, and the turning point was really that you can actually combine all of the above within medicine, and I'm lucky enough to do that. So you know, my life now is I'm lucky to be, you know, try to be the best possible doctor I can for my patients, but also from a research perspective, get to explore why things happen. A lot of your patients are asking, why me? That's exactly the question we're trying to continue to answer for them in the 20% of people that have heart attacks without risk factors. And then the other part of my role is really trying to work with the amazing researchers around the country to kind of shift the culture of research to be a bit more of a real celebrated asset for the country, and how we can actually work with our health leaders to really improve the efficiency where amazing discoveries and innovations can actually get to our patients quicker.
So one of the things when you and I first caught up that you shared with me that I thought was really interesting was, in a career in medicine, there's not a sort of predetermined path to follow, and therefore you have to be you know, quite proactive, or, you know, you really have to take that sort of into your own hands. How did you navigate that space, and why ultimately cardiology? And I say that because my understanding from the statistics is that I think it's of interventional cardiologists, less than 5% are female.
That's correct, yeah.
Yeah.
I think it's 4.5% on last year's data, I think, and that's actually probably increased quite a lot in the last 5 years, which is a good sign. But I think, you know, effectively, I mean, but cardiology is fascinating. I mean, the heart itself is, you know, it's a relatively simple pump, but the physiology and actually, obviously, the impact of keeping your heart healthy is something that is very passionate, you know, is a passionate focus of mine. In terms of the other practical aspects of it, I mean, I think the areas of unknown kind of research is attractive to me. The actual job on a day-to-day level from a clinical perspective is really I think exciting for me. You get to work with, I mean, actually just that kind of acute care in medicine, and keep, you know, the way you have to actually work with a diverse team of different allied health experts, and obviously the patient and their family, is something that has always been something I've loved doing. And I think, you know, at the end of the day, that kind of diversity from the research bench to actually looking after the patient is something that I'm very lucky to have. So I think it was probably also, I guess, a few different people that you meet along the way, and obviously the patients that actually inspire you along the way from when you're a junior doctor. And I guess in terms of your question about there not being that clear a path, I think in a sense there is a pretty clear path. I mean, these days it's slightly less clear because people don't go into medicine very often straight from school anymore. So at least that gives people a little bit of breathing space to go and do a more diverse range of things. I mean, I really enjoyed the early years of medicine, being very focused on those preclinical subjects. But, you know, I think having that diversity now in the graduate programs has probably been a really good thing. But after that, the internship residency, and then effectively, you know, being either a physician or a surgeon or a GP is actually, there are pretty clear paths.
Okay.
What is interesting is, though, you know, and I always tell the junior guys, you know, there's a lot of pressure coming through now because they increase in medical school numbers, and so they all feel like they're on a bit of they don't want to take any time going laterally for a bit. They kind of need to, they feel like they've got to keep moving because of this tide of doctors coming through.
Okay.
But I think what I've always said to them is, even if you win the race, you're still a rat, basically. So, the more different things you do, if you're passionate about them, I think the better. So from my perspective, I took a year out within the middle of my medical degree as an undergrad, did an honours year over in London, and had a fantastic year of science where I just cemented my love for the research, and then was lucky enough when I got back home to be, pushed a little to apply for a Rhodes Scholarship that I would never have dreamed of doing, and was lucky enough to actually meet Merida Telekar during that process, who was a great help.
And introduced us.
Yeah, so that was another, I then did something that was quite unusual. I finished medicine and then took 3 years out before my internship to go and do a PhD on a Rhodes Scholarship in Oxford, which again was very frowned upon by quite a few people because, theoretically, in those days you weren't actually allowed to be registered to do your internship if you'd taken time out between your medicine and that. But I was lucky enough to have some people that were able to see that what I'd done was actually hopefully not a type of a decrease in my ability to perform as an intern when I came home. So, look, I think it's as diverse as you make it, and I think I really, the more you actually take time to take steps in different directions, the more I guess you really benefit from that. And for me, I just learned so much of that independent thought process and some of my leadership skills in that process that I was very. I think that's part of who I am now.
So you were comfortable then taking risks and kind of backing yourself that it was going to be okay along the way?
Look, I think part of it was probably driven by an accident that I had when I was 18 or 19. I just after first year medicine, I was in Wyoming in the US skiing with friends and family, and had a brilliant day, unbelievable snow. But then I'd actually had my skis just sharpened the night before. But classic American way insurance, they decreased the DIN settings on my bindings, and so did a jump turn on the top of this steep run we've been doing, and then actually fell headfirst on 100 metre like a cliff, and managed to scalp myself. So you can see a little scar here. It was actually undid all the way around here, and it just unzipped my head. So I was
going to do a mini apology for anyone who struggles with that sort of images.
We didn't warn them beforehand, but I was lucky. My sister was there, and she kind of pulled it back together again. But my hemoglobin, which reflects how much blood I'd lost, suggested I'd lost about 5/6 of my blood, 5 litres of blood, and was barely. I was lucky to kind of survive that. So I think that really was one of the life-changing moments. The other thing that really, I guess, it helped me take, not so much risks, but take the interesting routes and be confident that was not going to be a bad thing, was a very close friend of mine who had cystic fibrosis and wasn't really expected to even get to university, but actually got into medicine and was doing medicine with us throughout the whole time. And his amazing will for life and doing things that for the right reasons was also a big inspiration, I think.
Wow. I know the answer to this, but your sister today, what does your sister do?
Well, she's running the COVID response for the hospital back here at the moment. So she's an infectious disease doctor now, but she actually wasn't in medicine at the time. She was still at high school, and she's
comfortable with blood and good head in an emergency.
Yeah, and she actually went on to do a lot of work with the ski patrol down at the snow in the volunteer fashion, and I think she's certainly got that ability.
Do you still ski?
Yes, with a helmet these days.
The helmet? I was going to say, and blunt skis.
I try not to have them too blunt, but no, it was that era before people had actually realised that skiing in helmets was a sensible thing to do. Yeah. So it was obviously in hindsight not such a clever thing.
I'm glad for all of us that you made it through that. Can I ask? Let's move to the Cardiovascular Alliance. And one of the things you said to me when we met as well, because I said, it seems like you've already got a fairly full plate. Why would you step into that as well? And your response to me was, I say yes a lot. We're grateful because here we are having this conversation that you also said yes to. But what was it about that opportunity that attracted you? Why did you say yes?
Look, I think I saw that this was it was a young organisation. The timing was right because we really had, this very generous investment in research, or generous but sensible investment in research of the Australian government in terms of the Medical Research Future Fund. But it was an opportunity to really advocate not just for the importance of investing in research, but actually to work with researchers but government around changing the way we use our amazing research assets that we have. And so I think we've actually seen it in COVID that really we can actually have the leaders of government and health work closely with our best researchers and clinicians to actually rapidly solve problems that we need to. And I think I really believe that we could actually make even more out of our amazing researchers if we actually get them better aligned with the actual leaders of our health system, helping the leaders understand where the gaps and inequities are in clinical care and outcomes, and actually come up and use discoveries and innovations from our country to actually improve health, not just of Australians, but also around the world. And so this is something that we've done. I really enjoyed shaking things up a little in terms of really trying to make sure that our fundamental researchers are actually really tied into a translational pipeline. And one of the earliest things we didn't actually cost any money, but has actually had a really big impact on the collegiality of the whole pipeline. And that's set up some really key flagships across the whole research section, implementation policy, trials, data, and then drug discovery and bioengineering and precision medicine aspects, which are much more fundamental, but actually driven by the clinical problem, is something that's made a big difference, again, without any money. But we were successful then, and also, I really enjoyed actually spending time in Canberra, working with both the minister but also the department to think about ways of, rescuing cardiovascular research at the time, but also on a positive front, let's actually do something that could actually inform us about how to change the research culture for all more chronic conditions. And so I really enjoyed that kind of policy element and thinking about strategies to really grow the sector and think about it as an industry. I mean, at the time, only about a tenth of the funding was coming to cardiovascular compared to oncology, if you considered the broader things. And I think that's a little bit to do with this apathy that cardiovascular disease is all self-induced and really we understand it, or it's just people don't look after themselves, which is absolute rubbish. And so that's actually kind of led to some big changes where we now, are testing some approaches that hopefully will benefit the broader research section. And I mean, for every dollar that's actually spent on cardiovascular research, the Deloitte's report shows a 10-to-1 return on investment. So if you actually just saw it purely as an industry, this is something that a clever country should be working on. So I think we can still see, further improvements. But a big passion was also trying to shift the culture and really make researchers feel indispensable part of the health system, but also look after each other in that approach.
Wow, that sounds like a fairly no-brainer, doesn't it, in terms of the investment for the outcome side of that. Talk to me about the research space then. Like, what do you feel most excited about what's going on in there? What do you need to do are there enough people moving in that pipeline? Are there enough females moving in that pipeline? Like, what do we need to be doing?
Yeah, well, look, I think, given the size of the problem, we really should. I mean, I kind of like to really tackle head on this concept that, cardiovascular disease is an inevitable part of aging, for instance, or, I see 100-year-olds with beautiful coronary arteries. There are people, it is not something that should be an inevitable part of aging. And so until we actually can maximise people's cardiovascular health through big jumps in our understanding, I think that we need to keep investing. And so this has got, as I said, we could actually really attract not just global companies in to work with us. I mean, the cardiovascular space is a very, is a profitable one from a market perspective. And, a lot of people, there's a lot of opportunity for drug discovery, device discovery that actually has got, massive global market that could be great for the Australian economy. And also obviously building up Australian companies and actually linking, providing that kind of much more, energized ecosystem that will actually be transformative, I think. So I'm not sure I really answered your question there.
Well, I want to know whether there's enough researchers, are there enough talented people coming through? And I know the research path might not necessarily lead to where you are, but if I sit and look at those statistics around under 5% in your specialty, as an example, a female, is it a broader problem, and are there opportunities to inspire more young girls like you were to sort of follow this sort of path?
Yeah, it's interesting. I mean, the research sector itself tends to take that same shape as medicine in terms of dropping off of females in the leadership roles. I mean, I guess I'm a little bit unusual in the sense of having, both of them is like a double whammy really for me. And, I think that's partly to do with in both the university setting and the hospital setting, we have a lot less turnover than, industries, and also even, cardiology in the US. They're actually seeing a shift in this diversity a lot more because people move around a lot more. In Australia, we tend to, be fairly, I won't say stuck in one place because it's a lovely place to be, but, as a result, there's not many new opportunities coming through. And even if with the best intentions in the world, without many jobs coming up for senior level people, it does mean that people tend to be a bit conservative in how we approach that. And so I guess from my perspective, how can we tackle that? I think part of it is actually, recognising that we actually do need a lot more people in the field, as you say, but also the bits around it that's actually going to energise the ecosystem. It's in some of this translational space and some of the commercial space that actually will also help, energise investment, not just from health, but also from industry, which will be really a game changer, I think. And so, I mean, for the scientist side of things, I try to one of the great things about working here at North Shore is that we actually have a really long-standing legacy of clinicians and basic scientists working very closely. The Colling Institute, which is where I'm based, is a fantastic state-of-the-art facility, but right next to the hospital. So it's literally a 20-metre bridge across to the cath lab, and where a lot of the work that we're doing is. I mean, I think the Army definitely needs to increase in the cardiovascular space, but I think that needs to be done through, I think, just recognising the huge burden of disease and the fact that research can tackle that. And research and innovation, therefore, is something that is an asset that we need to invest in now. We don't, with COVID, we obviously need to tackle it now. With cardiovascular disease, we probably need to say the same urgency because there's a lot of people dying every day of heart disease. So, I mean, one person every 12 minutes suffering a heart attack. So
wow, that brings it home, doesn't it? When you think of it like that. In your Cardiovascular Alliance, I noticed that you guys are running a mentor award. What's that all about?
Yeah, look, firstly, I think it's really important to recognise the amazing things that people do, but mentorship has got to be one of the number one things in our field that it needs to be celebrated. And we've got a really fantastic mentor program that our executive director, Kerry Doyle's been a big driver on, and that's actually a little different and actually really important in research because she's actually really got a lot of mentors from outside of research actually involved as well in that program, which is terrific for some of our scientists. We also have a Champions of Cardiovascular research program that actually is teaching people around better communication and leadership skills, as well as obviously consumer and community engagement. And so that's useful. But back to the awards, we've got an inaugural, a lot of awards that hopefully will actually happen in real life. But the big three awards that we've got for this year, one is the mentor one, which I think, as I said, is really important to celebrate. And then secondly, we've got one on kind of the game changer, and then one on translation as well. So not too many, but certainly really important areas that we'll be looking forward to celebrating with the community.
I think that's so important, because you hear so much of, you can't be what you can't see and those sorts of things. So any opportunity to, call role models out, I think is so important. Have mentors been important? And I'll go back to, I think, earlier when you brought up someone encouraged you to go for the Rhodes Scholarship as an example. Like, what sort of role have mentors played in your life and your career?
Yeah, I think, what I now read and learn about, and actually the Franklin Women mentorship program that I actually went through, a lot of that formality was not, pervading any of my mentor-mentee kind of relationships early on. But I think it was really a combination of role model and also, I think, sponsorship kind of concepts and people just looking out for you. And one of my early role models within my early years of medicine was Professor Bruce Robinson, who was an amazing physician, endocrinologist, but also basic scientist. And he was actually the one that did encourage me to pursue the Rhodes Scholarship application, which was terrific. I mean, at the time, women weren't necessarily, we're definitely in the minority in the successful Rhodes Scholar candidates, but in our year, we actually managed to get 8 out of the 9 scholarships in the country. So
wow.
It was a bit of a funny one. And in fact, Craig, who was the only male to go, was offered to be the cox for our 8. Unfortunately, he was about over 6 foot tall and probably not very suited for the cox seat. But I don't know if I'd say other role models. I mean, I think certainly one of my science teachers I mentioned earlier, Deirdre Land, who I haven't actually heard of from a long time, but I would love to get in touch with her, because she's really had a big influence on my passion for science and certainly, the can-do attitude kind of thing. And then, I think along the way, it's a little bit, I've been quite active in, I guess, getting advice from the right people rather than necessarily having any formal mentorship along the way. But, I think that it is a two-way process, really, isn't it? You do need to recognise what you're missing and reach out for it sometimes as well. Yeah.
How do you, you've got some pretty significant leadership roles. How do you, find the space to think about you as a leader and, with everything else that you've got going on? Do you? Can you?
I don't know if I think about leadership so much in a strategic fashion. I definitely think of strategy, which, in a sense is what I then need to try to convert to action. But that strategy is more in actually how we're going to change, the ecosystem rather than necessarily what am I doing to improve my own leadership skills. I mean, I think one thing I have got hopefully a little bit better at is recognising just how actively you need to listen to the whole team and just how valuable all of the diverse inputs are that you can get. And I think that's been helpful. I do also, recognise that your vision and your ability to see the right path, does require a bit of downtime. You do need to actually get out and have some time to think, and that's something that I get mostly from exercise, actually. So long runs or cycles or a bit of yoga or something is actually always a great way to clear the head and get back to it. So making time to get the vision right and then developing the strategy, I think is really important. But then for me, it's also about inspiring the team and trying to figure out how you can best do that. And that tends to be all about your energy and also, I guess, recognising what drives the individuals that you're working with. I think I don't actually probably think enough about how to do it well, but
I wanted to ask you as well, I lost my own train of thought as you were just saying that then. Importance of a network for you. I know that you've got a little group, Hearts and Heels. Tell me about your network.
Yeah, I mean, interestingly, that is one of the examples of networks, but it's a group of female cardiologists that actually, I think the Heart Foundation actually originally got together in New South Wales, and it's been on the front end of a lot of advocacy around the importance of the female voice in departments and obviously other things, and worked with groups from outside of medicine to try to actually, get male champions of change and things like that as well, which we definitely need. I think it also is just a bit of a good time to sit down and have a laugh of our experiences, because it is a very slowly changing field, and particularly given at least half our patients are women, and on top of that, we do bring a different approach to the way medicine is done. So I think it has been a really useful network. I mean, from my perspective, also the networks outside of medicine and research, through team sport or through your other friendships and things, is equally important. And for me, even during COVID, the international networks are actually a fabulous kind of time to get real perspective about what's happening in the world, and how lucky we are in a sense.
Have you, and people often get uncomfortable with this question, but I just wonder, why do you think you've been so successful in this space?
Look, I think early on I became aware that I was very aware in my early teenage years that trying hard was, frowned upon. And the concept of a try hard was something that people used as an insult, and I just didn't understand that at all. I think I'm someone that, has, I guess, moderate amount of different talent, but it's actually probably the mixture of talent, but also, number one, just nutting down and trying really hard and actually loving the things that you try the hardest for are the best, when you actually get some success. So for me, it was recognising that it was absolutely fine to kind of go against this concept of being a try-hard, and I celebrated being a try-hard, and so I think that's probably why I actually managed to do okay. I mean, I think the other thing is that kind of comfort in just, taking steps that might not be part of the traditional rat race, and everything I've learned in that process.
Like many other women, do you sometimes, have feelings of self-doubt, or, I think you hear the term imposter syndrome and things like that. Like, does that part of your experience?
Look, I think absolutely. I think the thing that I just, is always just being a mum is something that I'm still absolutely do not understand how people can do it so well, because, just wrestling the children out the door this morning, they're lucky enough to actually be going to school. But we, they're just, I just wish I could inspire them to actually follow me and do what I ask them to do.
You're not on your own in that regard. I was just thinking before when you were talking about the try hard, I've got teenagers, and I think the new term for try hard is they're sweaty.
Oh, right.
Yeah. So if you hear the word sweaty used at your home, don't assume it's to do with sport.
Yeah, it's interesting. I mean, it is a bit of an Aussie thing that I think when I was in particularly Oxford, I think it was just really very a nice relief in a sense to be in a place where people really did weren't afraid of trying hard and actually, celebrated it. And then, I mean, I think Australia probably has changed, and there are, certainly people are supported for doing their best.
So any times during your career path where you felt, I'm not sure if this is the right direction for me, and push through it anyway?
I think because I've got such different bits of my week and days that, what's actually happened is I've been able to just push forward with the things I really enjoy. Whereas I think there probably are aspects within medicine that, if you end up following the more prescribed version of a course, that you might, suddenly realise you're down a pathway that you don't particularly want to be in. But by having that slightly unusual diversity of, that really those three jobs that I've got, I can balance the weight a little bit, which is a real, a lucky situation to be in.
Do you have a typical day?
I have a typical week.
Okay.
And I guess that really, does change depending on how much on call I've got and things like that. But, that is, my job is really enabled by being in a hospital that does allow, fundamental research to be done at a high level right in its midst with, literally a lot of the work we're doing is trying to unravel why the patients that are sitting just over there in the cath lab are having their heart attacks. And, we actually often running between the cath lab with, patients' consent and registry and the blood and, straight to the PhD students who are actually doing work on unravelling the remaining mysteries there.
Absolutely fascinating. Before I ask you the final question, there's a gender lens that I guess these conversations are surrounded in. Have you, is there something that you'd love to say to girls in school maybe who might be considering a career in medicine?
Firstly, obviously, go for it. It is a fantastic profession that doesn't necessarily have to take you in any very prescribed direction. And as, for me, tossing up between the teaching and the science, I get to do that as well. I think these days for kids growing up, the other thing is medicine is something that you can do as a graduate, and that's actually now the path in. So really it's actually just getting your teeth stuck into how amazing the human body, physiology is, anatomy is, and really just passion for that, and actually making the most of any resources you can to improve your knowledge and understanding and awe at that. And if that's something that drives you, medicine is certainly something that is a very rewarding direction. But so is medical research, and that's actually something that is definitely can be a very, very rewarding career as well.
Or do both, like yourself. Why stop at one? Gemma, the final question I ask everybody in the series is, from your perspective, what does brave feminine leadership mean, and do you think it needs to change?
Look, I think brave probably refers to most leadership where you're actually expressing a different view than the norm. And if you're going to actually change the ecosystem and the culture, that does need some courage. I think always, if you're the only woman in the room standing up again and, suggesting a different path to what's been taken before, that is brave leadership to a degree. But it's the same for any minority view or group, I guess. So in terms of what needs to change, I think continuing to do work on, promoting the value of diversity and also addressing any of the hurdles that exist to either gain improved diversity or to actually support the voices of those that are in the minority.
So amongst the kids, your role as an interventional cardiologist, leading research, chickens and whippets, which is the hardest to manage?
Definitely somewhere between the kids, the chickens and the whippets.
Thank you so much for joining our conversation, Gemma. We're, incredibly lucky to have, incredibly passionate and talented people like you leading the charge on this. So I'm so glad you said yes to our conversation and look forward to the outcomes of the incredible research you guys are doing.
Oh, thank you very much. I really enjoyed it.